So I did write a Vein magazine article. You do have it on your tables. It's also in the Vein magazine. It was handed out at the meeting. So a lot of what I talk about today is going to be in there. We know that the mind and body are connected. So whatever happens in the mind affects the body. Whatever happens in the body affects the mind. And I was looking yesterday at all the happy people at this meeting. I mean, everybody was happy and having a great time, and I'm like, wow, this is amazing. So I should really thank the AVLS for providing us a very happy place where we can totally nerd out on vascular disease. But there's a lot of crazy stuff going on in the world, right? So I bet you there's some mental health going on in this room right now. And I know I've had a couple of huge stressors in my life over the past couple of years. So I have some mental health experience. And I think it does affect the way I take care of patients. And I'll give you an example. I had a telehealth appointment with a man in his 60s. He has Derkham's disease, diabetes, sleep apnea. He's living with obesity. He eats late at night. And I called him up, and I was kind of feeling like I had pushed the whipped cream and cherry off my shake, and I was just the shake today. I had no Dr. Happy whipped cream going on. So I said, hi, Mr. X. This is Karen Herbst. He said, hi, Dr. Herbst, how are you? And I said, pretty good. And that's a sign, right? If someone's pretty good, they're not actually good, right? If you're good, you have to say, I'm really, really good, right? Or yeah, I'm really, really good, but I was pretty good. And then when I said, how are you to him, he said, I'm fine. And like Darren said, I said to him, but are you really fine? And he said, no. And his wife said, he's having a lot of pain. And so we had our appointment. And he was having a lot of mental health issues that were affecting his body. And what was going on in his body was affecting his mental health. And we know that, well, I think it's generally accepted that women's minds are different than men's minds. For example, let's talk about chickens. So you're in a chicken yard and you've got a rooster, and the rooster is taking care of 3 hens. But if each of the hens has 12 chickens, I guarantee you each hen is taking care of those 36 chickens, because chickens are cute, but they're also little brats, right? So the rooster's taking care of 3 hens, and the hens are taking care of 36 little chicks. And we know that women are dominating vascular disease. There's more women with lymphedema, venous disease, and lipedema, which is a form of lymphedema. And women are affected in terms of their mental health by what they have going on in their body. And I can guarantee you, if you take all of women who have vascular disease and you put them into a group, every aspect of that vascular disease will affect at least one of those millions of women, right? And that includes, for example, a spider vein. Now you might think a spider vein is just kind of like, it's there, it's not a big deal, but for a woman, that's her 37th chicklet, right? And she's monitoring that every day. That's something else for her to monitor. So it affects her mental health. One of the kind of patients that comes to me in my clinic is one that has a high affective reactivity. And this is their outward expression of their internal emotions. And I'm sure you've had them in your practice. You might say like, oh, you do have some varicose veins. And they say, is that dangerous? Or, I do think that you have stage 2 lipedema. Am I going to be in a wheelchair? Right? That's affective reactivity. That's high affective reactivity. And another way to say this is, what is the person's behavior or expressivity on days when they have stressors or during a stressor compared to a day when they don't have a stressor? And people who have higher affective reactivity have an increased risk for chronic disease, like Darren said. And this may occur because of inflammation. So people with high affective reactivity were found to have high interleukin-6 levels, which is a marker of inflammation. So by being overreactive to something, you generate inflammation in your body. You can actually generate disease, or you could worsen disease. And women who have high affective reactivity, when faced with minor stressors or stressors of any kind, are at particular risk for generating a lot of inflammation. And voila, they have a lot of vascular disease. Isn't that interesting? And I bet you it breaks down the glycocalyx. So here's another way to look at it. So you have your brain's programmed to have high effective reactivity that generates inflammation in your body, which then feeds back and affects your brain. And then the body produces more inflammation, which increases your stress, and it becomes a vicious cycle. So in my article, I have a list of resources, and one of those is a questionnaire for effective reactivity, and it's just 6 questions. And if you have a patient who seems highly reactive to everything, I think it's really important to document it. Yes, they have high effective reactivity because you're going to treat them a little bit different. So for people of high effective reactivity, you're not going to take on everything that they say, like, oh, it's okay. No, let me show you. We'll do things. We'll take care of you. No, what you want to do is empower that patient to take care of themselves, because they feel better when they're empowered, not when you take on all their stuff and then get burnt out. So one way not to get burnt out, like Darren said, is to empower the patient. So I have patients in my practice who have mast cell activation disease, and they itch a lot. They scratch their itches. They have the itch that starts on the arm and it goes down the arm and it ends up down the body. It's like the never-ending itch. So how many of you ask about itching in your practice if you're a vein practitioner? All right, that's awesome. So how many of you think that venous itching is associated with mental health issues? A couple of you, yeah. That doesn't exactly seem logical. But in a study of 700 individuals with varicose veins, with and without itching, the ones that had itching had significantly poor quality of life, more comorbid conditions, higher leg pain, and were more than 1 standard deviation below the mean for the US for the mental and physical health scores. So itching, what an easy thing to do is ask, do you have itching? And that you should go ding, ding, ding. This person is probably in trouble. So how do you promote mental health care in your practice? You don't have time, right? But I think that 6-point questionnaire is good. Asking about itching is good. And you can also let your patient know that mental health issues are really common with vascular disease, and make it a common thing. Yeah, they go together, and it's okay. And we know, and you know, and we're going to empower you to take care of yourself. Refer out when you need to a psychiatrist or a psychologist, and consider personalized care planning. And this just means you sit down, you identify goals for the patient. You are their counselor. You're going to help them take care of their venous disease or their lipedema or their lymphedema. You're not going to do it. You're going to give them advice and help them every step of the way. And you're going to encourage them to work with other practitioners as well to take care of their disease. And I say, you're the boss. And when they say, well, what do? I say, well, let's look at everything that you could do, and we'll make a decision together. So with that, I'm going to introduce Karen Ashforth.
Thank you, Dr. Herbst. And a scathingly brilliant use of the term glycocalyx.